Hello everyone, our today topic is about pregnancy-induced hypertension. From this pregnancy-induced hypertension, today we will discuss about preeclampsia. First, what is preeclampsia? Preeclampsia is one of the pregnancy-induced hypertension, and we can define preeclampsia as a new onset hypertension with proteinuria, or the other definition is a new onset hypertension with end organ damage with or without proteinuria. One is new onset hypertension with proteinuria, or new onset hypertension plus significant end organ damage with or without proteinuria, plus one another very important necessary criteria, which is gestational age. The gestational age should be greater than or equal to 20 weeks of gestation. Sometimes the preeclampsia can occur after delivery. So when we summarize preeclampsia, the definition of preeclampsia, the blood pressure should be greater than or equal to 140 by 90. Either systolic or diastolic is enough to diagnose elevated blood pressure, but the measurement should be at least 2 times 4 hours apart. Sometimes if the blood pressure is greater than or equal to 160 by 110 minutes are sufficient for the diagnosis of elevated blood pressure. So preeclampsia is elevated blood pressure plus proteinuria, or elevated blood pressure plus end organ damage with or without proteinuria. So this is the criteria to diagnose preeclampsia. But you should understand that the gestational age should be greater than or equal to 20 weeks of gestation. The other is what is proteinuria. The criteria to say proteinuria, one is the amount of protein within 24-hour urine should be greater than or equal to 300 milligram. The other is protein to creatinine ratio greater than or equal to 0.3, and the other is the urine dipstick measurement of proteinuria should be greater than or equal to 2 plus. So this is the criteria to say proteinuria. The other very important concept is the classification of preeclampsia. Preeclampsia can be divided into two: preeclampsia without severity and preeclampsia with severity features. What are the severity features of preeclampsia? One is elevated blood pressure greater than or equal to 160 by 110, at least for 2 occasions, 4 hours apart. The other is thrombocytopenia or platelet count less than 100,000, and the other severity sign is pulmonary edema, and the other is neurological symptoms like severe persistent headache that is unresponsive for antipains, and also and this headache should not be explained by another differential diagnosis. The other is visual disturbance. The visual disturbance includes like blurring of vision, flashing of lights, scotoma. This is a neurological manifestation of severe preeclampsia. The other severity sign is impaired liver function. That means when the liver enzyme elevated at least 2 times of the normal, and or if there is severe persistent right upper quadrant or epigastric pain, and that pain is not responsible for medication and also not explained by another differential diagnosis. The other severity feature is kidney injury, acute AKI. That means when serum creatinine greater than or equal to 1.1 milligram per deciliter, or when the serum creatinine is become double in the absence of other possible diagnosis. So what are the severity? In order to summarize the severity of